Hi, I'm Rick Cooper, Professor of Nursing at Allegheny College in Maryland and a Level 3 graduate of McCirc, together with Sandy Clark, Professor of Nursing and also a Level 3 graduate and Professor of Nursing. We're here to discuss and demonstrate how we use simulation to teach critical thinking beyond the diagnosis. Throughout a nursing program, we have simulation experiences to match our system being taught. If the students are learning about cardiac, they know the simulation is about cardiac. They were not using critical thinking beyond the diagnosis. We also recognize that students were not looking at the whole patient in the clinical setting. They were only looking at the admitting diagnosis. Sandy Clark created a post-op simulation with multiple potential issues. The patient is a 50-something-year-old male, diabetic, admitted for a colon resection. We used this simulation in our last semester, Advanced Med-Surg Nursing. The goal of this simulation is to demonstrate critical thinking beyond the diagnosis. This simulation can be done with individual students or in groups. We usually split the class into groups of 4 or 5 students, but for this demonstration, we used individual students. The paperwork is given to the students the day before the simulation experience and is attached to this sim talk. We hope you enjoy our demonstration of critical thinking beyond the diagnosis.
Good morning. We're going to do the simulation this morning on the post-op patient that you all were given the assignment yesterday. So you already have his description, you have his lab work, his orders, etc. You all have the same patient. So it is very important to remember you signed confidentiality agreements. Do not go out of here and discuss this patient. Consider this being a hospital patient. The first thing that I want to show you is some of our equipment, just to familiarize yourself with it. So this is your patient. The bed controls to put the entire bed up or on the outside, controls on the inside if you need to put the head of the bed or the foot of the bed up. You're going to have his vital signs up here on the monitor, but if you want to go ahead and get another blood pressure, it's a touch screen. You simply touch the red area that says NBP. If he needs oxygen, your oxygen cannula will be laying here, the flow meter's on the wall, and if you need his oxygen saturation, we'll have the saturation for you. This is his IV pump. This is his PCA pump. He's a post-op patient, so he's getting his post-op medicine. We also have an Accu-Chek machine because he's a diabetic. Stethoscope is here for you to assess your patient. When you are done your simulation, I will be giving you an assignment. Rick and I will just go ahead and give them to you, okay, just to make it easier. You need to go somewhere by yourself, and you need to answer the questions. When everyone's done, we'll get back together in the classroom and we'll discuss your findings. So please, again, remember confidentiality. And do you have any questions? Okay, great. Thanks.
Hi, my name's Mariah. I'm going to be your student nurse today. Can you tell me your name and your date of birth?
David Moore. June 2nd is my birthday, and I'm not feeling well at all.
You're not feeling well? What? Do you have any pain?
My chest.
Your chest? Can you give me on a number scale of 1 to 10, 10 being the worst?
At least a 10.
A 10? Where on your chest do you feel the pain?
Across my chest, up into my neck.
Across your chest, up into your neck? I'm going to grab your vitals here. Can you give me a word to describe your pain?
Crushing.
Crushing?
I feel like someone's crushing my chest.
Like someone's crushing your chest. Does anything make it better or worse?
No.
No?
It's just really, really hurting.
Okay, I'm going to listen to your chest, okay? Okay, I'm going to call your doctor and see if I can get you something to help with the pain, all right?
Okay, great. So this is where we'll stop the simulation. I need you to take your assignment paper, go someplace by yourself and answer the questions, and we'll all get together as soon as everyone's done.
All right, thank you. Hi, my name's Carrie. I'll be your student nurse today. What's your name and birth date?
David Moore. June 2nd. I'm really short of breath.
You're really short of breath? When did it start?
A little bit ago, my chest hurt.
You have pain? Do you hurt anywhere else?
Just my chest.
So the pain in your chest, on a scale of 1 to 10, with 10 being the worst, what number would you give it?
12.
12? Okay, well, I'm going to get a set of vitals for
I
you.
feel like I can't breathe.
Okay. Does anything make it better or worse?
No.
Okay, well, I'm going to go call your doctor to see if I can get anything for your pain, okay?
First, I'm going to listen to your chest.
Oh, please.
Okay, now I'm going to go call your doctor, okay?
Okay, and this is where we would stop the scenario, and I need you to...
Hi, I'm Maxwell. I'm going to be your student nurse today. Can I have your name and date of birth?
David Moore, June 2nd.
And what's going on, David?
I'm really short of breath. I can't even get my breath.
When did all that start?
Maybe 5-10 minutes ago.
All right. Does that help, raising the bed?
I'm still short of breath.
All right, I'm going to listen to your lungs here real quick. Alright, I'm going to go call your doctor and see if we can get something for your breathing, okay?
Okay, and that's where we...
Good morning. My name's Gabe. Can I ask you your name and your date of birth? Alright, Mr. Moore, I'm going to get some vitals on you real quick here. How are you feeling, Mr. Moore? Mr. Moore, I need help in room 252. Placing the patient on 2 liters of O2. I'm going to stop the PCA, and I need you to get an AccuCheck, and I'm going to get some Narcan.
Perfect, and that's where we would stop the scenario. So, how did the scenario make you feel?
I liked it.
I thought it was good.
Okay, great. So let's go through our assignment papers and we'll talk about this patient. So Mariah, what do you think happened with this patient?
I think he had an MI.
Oh, okay. And what do you think was the cause of the problem?
Could have been due to stress from surgery, blood loss during surgery, or an electrolyte problem.
Good. And what actions would the RN do?
As the RN, I needed to call the doctor and get an order for nitroglycerin and maybe morphine or aspirin. And I would also need an EKG, lab work, or a transfer to ICU or CCU.
Perfect. That's great. So did you all figure out that he had a heart attack?
No.
No. Carrie, what do you think happened?
I think he had a pulmonary embolism.
Oh, what do you think was the cause of the problem?
It could be because of immobility before and during surgery or dehydration.
Okay. And what do you think the nurse could do?
We could get an order for a CT scan, oxygen saturation monitoring, give more oxygen if he needs it, and an anticoagulant like heparin.
Oh, they're doing good.
I thought we all had the same patient.
You did all have the same patient, so I guess you're going to come up with something different, right?
Yes.
What did you think, Max?
I thought he was hypoxic.
And what do you think caused that problem?
His smoking and maybe hypovolemia from his surgery.
That's good. So what could the nurse have done?
Get blood work done and call for a new oxygen order.
That's great. And I guess you're going to come up with something different, right? What did you think?
I thought he had too much sedation from his surgery and his PCA, or he could have been hypoglycemic from his diabetes and also being MPO for a few days.
That's great. So what do you think the nurse could have done?
The nurse could have turned off the PCA pump, given Narcan, and assessed the AccuCheck and given glucose if necessary.
That's great.
But I thought we all had a surgical patient with abdominal problems.
So it was a surgical patient. So the importance is to remember you can't focus on the diagnosis. You have to look at all the different things that could happen with this patient. Okay. So because of that, what else can you think of that could have happened to this same surgical patient?
He could have had bleeding inside or peritonitis or even a DVT.
Good.
He could also develop pneumonia due to the smoking, the stasis of secretions, immobility during the 12-hour surgery, some blood sugar issues from his history of diabetes, and just the stress of the surgery and being nothing by mouth.
That's great.
He could have had some psychosocial issues related to having a colostomy for the first time. Also, insurance and lifestyle changes. I think he's definitely going to need some teaching needs before discharge.
Great.
He could have had an electrolyte imbalance from suctioning through the NG or kidney problems from hypovolemia.
Good. So if you were confronted with this same scenario again, is there anything that you would have done different?
I would have put the O2 on him through a nasal cannula.
Yeah.
And I remembered to put the O2 sat monitor on, but I didn't check it as soon as I put it on. So I would do that.
That's great. I think you all did a great job.
Absolutely.
Thank you.
Thank you.
Absolutely. So can you see, as nurses, how we have to think beyond the diagnosis and think beyond what we see? We have to pull all the information together, not just that admitting diagnosis. We had a 52-year-old male patient, a smoker, a diabetic, a truck driver, who came in for a simple colon resection, and look at everything that happened. One patient. That's why we must critically think beyond the diagnosis.